Perfect. Okay. Hello, guys. Listen, I'm here today with Holly, and Holly, I really do appreciate. Yes, Holly, I really do appreciate you joining me today. I know that yesterday we had a lot of issues with the production, and I was trying to get everything working, and it didn't work, and so we had to reschedule today. So I really do thank you for being with me today and taking time again with me today.
My pleasure.
Now, Holly, I know that you started care with us back in January of this year. And I know that, and listen, guys, if there's a lot of you right now that are watching this that have been suffering with hormone issues, that have been suffering with insomnia, anxiety, or depression, you've got to sit in with this because, guys, we're going to peel back the curtain today and show you the exact processes in which we're able to help Holly get her life back and help her enable to get her control back over her health. So, Holly, with that being said, you started with care with us in January. Tell me a little bit more about yourself before menopause. What was your life like? What was your health like before the 54 years before you started having issues?
Before menopause, I am normally a very high energy person, like a Energizer bunny. I mean, I was going. I'm very active as far as like health and fitness. I exercise a lot. At about age 50, my husband, who is actually younger than me, he was only 48, got diagnosed with heart disease. And at that point, I should probably tell you, I believed that sugar was there for a reason, and that was for me to eat it. But, and when my husband got diagnosed with heart disease, I did a ton of reading, and we changed our diet really drastically at that point. So I was eating really healthy, a lot of vegetables. Before that, I thought that vegetables were just a decoration for the plate, but I had started eating vegetables. So I would say I felt great, before menopause.
So here you are, you've adopted a new lifestyle. You've really embarked on eating healthy, taking care of yourself. So with menopause, tell me what happened.
Well, it kind of snuck up on me with perimenopause, but I began having hot flashes, and the hot flashes started out. Actually, they hit kind of hard now that I'm remembering back. They hit, and I felt like even among my friends who are around the same age, I was having excessive hot flashes, and they were powerful, and they were, drenching the sheets at night. I was having them all the time. And from there, I started developing anxiety feelings that it was almost like I could tell when a hot flash was going to come because I would have a feeling of anxiety that would come. And then I started having a feeling of anxiety, the hot flash, and then depression. And the depression feeling would linger. It was literally a feeling like, what's the point? Like, what's the point of living life? I mean, and it would linger. I was having difficulty sleeping. I was staying up ridiculously late at night. I started relying on glasses of red wine to make me get sleepy. And then in the morning, I was relying on coffee to wake myself up.
Yeah.
I would just slog through the day. I gained up, and I'm a small person. I'm only 5 feet tall. I gained about 15 pounds over a 2-year period. And for me, that made my clothes not fit. I was very frustrated.
Well, it's, that was an incredible breakdown of what's been happening. So you went to your doctor, your primary care doctor, and then you went to your OB-GYN, I think I understand.
Yes. Yep. My OB.
So what did they want to do? What did they recommend?
So I explained all the symptoms I just explained to you to my OB-GYN, and her solution was to put me on an antidepressant. And I am not a doctor, but that just seemed wrong to me. That just didn't make sense. I'm like, it's clearly something hormonal that's happening. So I started researching on my own natural. I tend towards wanting to do more natural remedies anyway, but I started researching natural ways to deal with menopause symptoms, and I came across integrative wellness centers.
Oh, I was going to ask you how you found us. So you found us searching around, looking for us.
Yes. Yep.
What was it about our clinic why did you choose us? I guess there's a lot of other people out there, a lot of clinics. Why did you land on our page? Why did you decide on us?
I quite honestly, I think it was you. I had seen, I don't know if you're regularly on one of the news stations, but I had seen an interview with you. I think, and I was just impressed with, I know what else too. I think on your website, maybe you talk about, not dealing with the symptoms of the problem, but getting to the cause of the problem.
Yeah, absolutely.
Yeah, I remembered reading that on the website.
So when you came in and talked with, I think you met with Dr. Makoviak originally.
Yep.
When she sat down with you and she outlined for you that, hey, this is the testing I'm recommending. This is she recommended a stool test for you. I think you had to have been thinking, what in the world did I get myself into? Here, I'm coming with it. So you go to your primary care, you go to OB-GYN, and she's like, here, take some medications for depression. And then you come to us and we're like, hey, do a stool test. You're like, hang on, I'm not ever having any digestive problems. Why would I do a stool test if I have hormonal issues? So you did a stool test, you did a nutritional evaluation, you did a comprehensive blood test. I mean, you had over 200 markers that we did originally.
Yep. It was very, very exciting.
What were you thinking after that first visit?
I just was thinking that this was really something I wanted to try. I wanted to do, even though there was extensive testing, I felt like I knew that every solution that you guys were going to come up with was going to involve food or nutrition, or it wasn't going to be a drug, you know? And so I had brought my husband with me to the first appointment, and he was very skeptical.
Oh yeah. I would be too.
Yeah.
Especially when they came to me and said, hey, your wife's having hot flashes, and by the way, we want to do a stool test.
But he's the one that encouraged me, because I was randomly like crying and stuff, which was just not like me. And he was like, we need to find something. Something's wrong. We need to get you fixed. So he was open to it, you know, and after we got the test results back, he was very impressed with the depth and the level of the testing.
Yeah. Well, let me ask you, so you get the testing, we start your care. Tell me about your journey. Like, what was your journey like as you went through this process? Well, I mean, I know you didn't immediately start feeling better, so I've got to imagine 2 or 3, 4 weeks in, you're like, what in the world what am I doing?
Yeah.
So tell me about that.
Yeah, especially the first 28 days were the absolute hardest. That is where you peel back, like they call it the elimination diet, you guys. Yeah. And I joked with my husband, they call it the elimination diet because it eliminates anything fun you could ever possibly want to eat. It eliminates everything. So those 28 days were really tough, but I was like, I'm doing this. I've committed to this, so I'm sticking with it. And quite honestly, by the end of the second month, now that you start, you know, after the
first month, let's go back. So the first month of doing this extreme elimination diet.
Yeah.
Well, it's not extreme. I mean, it's eliminating sugars, eliminating dairy, eliminating gluten.
It was extreme for me because quite honestly,
alcohol.
I thought, my husband's like, this is not going to be that hard, because we had changed our diet completely for his heart disease.
Yeah.
But it was even more extreme than that.
I'm sure giving up coffee and then giving up alcohol was like, oh my gosh, what are you doing to me? That's how I go to bed, and that's how I wake up.
Yep. I really thought I would not be able to sleep at night. I thought, how will I be alert for my work, you know, during the day?
So what happened? Tell me about that. What happened the first week or two after you started this diet?
Oh my gosh, that's such a hard question. I don't remember having, you know what, I think probably in the first couple of weeks is when I figured out, gee, I guess I don't need red wine to get sleepy. I am getting sleepy without it. But I still, you know, I was still staying up late.
Yeah.
But I could get sleepy without it. And not having the coffee, I will confess I broke the rules a little bit, because Dr. Mack she was saying, you need to just cut it out in 2 days. And I thought, I'm not doing that. So I weaned myself off over the course of a week.
Absolutely.
So I did sort of cheat in that way. But I'm only a 1 cup of coffee a person anyway. Like I only have 1 cup. So I guess I probably am sensitive to caffeine and didn't really realize it, because I can't have more than 1 cup or I'm bouncing off the walls.
So how long was it before you started noticing a difference in your sleep and your energy and your hot flashes? How long did it take?
For the sleep and the energy, by the end of the second month, 180 degree difference.
Yeah.
It was a complete turnaround. My energy was consistently a 9 or a 10. The anxiety was gone, I believe. The depression feelings, if they weren't gone, they were at least significantly diminished.
Yeah. And that's because your sleep was improving, correct, at that time?
Right.
Yeah.
Right. The only thing that I wasn't super happy with was after the first 28 days of torture, I went in, and as I told you, I'd gained that 15 pounds and I'd lost like only 4.2 pounds or something like that. And I was like, hey, doctor, what? She goes, that's not the point. The point is to get you feeling better first. I'm like, all right. But the hot flashes were tougher. I'm a tough hot flash case. She ended up introducing black cohosh.
Yeah.
I can't remember what month that was, but that was a huge game changer for me. It was like, boom. You know, I
Awesome.
rarely, I have hot flashes they're way less than they were. And even when I have them, they're much less powerful. Like I can talk through them and nobody knows I'm having a hot flash. Whereas before that was not the case.
All right. Well, you know, it's interesting is I looked over your case before we met today, and I was looking at your testing, and some of the things I found, like for example, your iron was low-ish. So your iron levels are typically anything over 45 is normal. Your
Okay.
iron levels were 49. And so that's really close to the bottom of the barrel. But if most medical doctors would look at that and go, that's not a problem. But in my world, I got to think, well, if optimal, and my world, I like working optimals, not just black and whites. Because if you're at 49 and then 46 and at 45, and now we're going to talk to you at 44, why don't we start having that conversation beforehand? And so I'm looking at that going, why is she running low in iron? And iron's so important because iron's going to help your thyroid function. And if you have low iron levels, your thyroid's not going to function like it should, which is going to affect your metabolism. It's also going to affect your mood because now you're low energy.
Okay.
And then another thing too with iron is it's when it affects your thyroid and it hampers your thyroid function, your thyroid affects every other hormone in your entire body. So the estrogens that you do have, they're going to be less impactful. The progesterones that you have are going to be less impactful. One of the things that's real important to understand is that when we're talking about hot flashes, we're talking about usually an imbalance of the progesterone and estrogen levels. And when those two get out of balance, they're kind of like the yin and the yang. So estrogen is actually the more excitatory hormone, and progesterone is the more relaxing hormone.
Okay.
And so but here's the thing, if your progesterone levels are normal or a little bit lower than normal, if you have low iron, or I'm sorry, low thyroid function, then now those hormones are going to be affected. They're going to be even more sluggish, so they're not going to be as impactful. So if your thyroid levels are normal, you're just going to make your hormones more effective or less effective because it affects every other hormone. So just like with thyroid, it helps your metabolism, it also helps your hormones function better.
Interesting. Okay.
But then we have to ask the question though, why is she low in iron? Here's a person that eats well. She has a well-balanced diet. You weren't vegan. You're not vegetarian. So you're eating meat. Why is your body low in these irons? And so it's interesting is we then look at your stool test. And if you don't mind, I'd like to kind of show everybody what's happening with your stool test so they can kind of see this.
Okay.
But let's go into that. So we're going to go in the desktop. I hope we can come back to this. This is going to be terrifying. All right, here we go.
Okay. Oh, I can see it.
All right, good. So let's open this document here. All right, there we are. So there's your stool test. So starting here at the beginning, no parasites, no bacteria infections, but here we go. H. pylori was high. H. pylori is 3 times higher than it should have been. And H. pylori, if people don't know, that's what causes ulcers in people's gut. It's an overgrowth of bacteria. And so a lot of times when they get ulcers, the doctors will put them on antibiotics to kill that bacteria. So here we find you have H. pylori. Did you know you had H. pylori before you came in?
No, I didn't even know what H. pylori was.
Okay. So if you have ulcers, it can actually also cause internal bleeding on a low level.
Wow.
So that could have been another cause of the lower irons, that your body was kind of sucking that iron out because you could have had some microscopic bleeding at your stomach level. We don't know that for certain, but that's just one of the clues. But then, so we know we have an infection in the gut called H. pylori. We come down here to the normal bacteria. What's interesting is we know that these certain bacterial strains, and I don't know if you guys can see this. I'm going to try to draw something. Let's see if this works. Do you guys see my mouse now?
I can see it.
Okay, cool. So this right here, these bacteria here, each one of these bacteria have been linked to helping the body make certain neurotransmitters. For example, bacteroides could relate to serotonin, or could relate to dopamine. It could relate to GABA, which helps your body sleep. So each one of these bacteria actually help your body make your neurohormones or your neurotransmitters in your brain. And so if somebody's having trouble sleeping, we can think, well, maybe they're low in serotonin, maybe they're low in dopamine. So we know that helping establish these normal bacteria levels can absolutely affect your mood. Have you ever heard that, the brain's connected to your gut?
Yes, I have heard.
Yeah, and they say that like 60% or 90% of your serotonin levels that are in your brain are actually made in your brain.
Yeah, yep.
So that's real important. So we know now that you're low in these bacteria. We come down further. Now this is where we really saw a lot of flags. I'm going to go ahead and jump down here to the talcoprotein. This is inflammation in your gut. You guys see that, the 365?
Yep.
anything above 50 is way too high. So you have 7 times too much inflammation.
Wow.
Now, this one particular marker has been linked to colon cancer.
Wow. Okay.
So your gut's inflamed. So it brings back to the question, is that H. pylori that we're looking at earlier, was that causing inflammation? We look at those foods that you're eating and we say, are there certain foods that she's eating that's causing inflammation? And so lowering the inflammation of your intestinal system is going to help you absorb the food and the minerals that you're eating, which is then going to help you make the hormones and the neurotransmitters properly. So that's why we always like to look at the gut with our hormone patients. The other marker that's important on here is this one called beta-glucuronidase. And this is really high as well. This one's specific to estrogen dominance. So it can cause estrogen dominance. It's also been linked to breast cancer and other types of estrogen type cancers, because this enzyme actually pulls the estrogen back out of your gut and puts it back into the blood. So now you have more of an estrogen dominance, which is more excitatory, which is more anxious, which means you don't sleep as well.
Oh,
Interesting.
cool. Yeah.
So balancing your gut was a real big factor, and I think in helping you. And once we get the gut under control, then we retested your iron, and now your iron levels. And remember, I told you were at 49 and optimal 75. Well, guess what? You're at 75 now.
Okay.
So now that the iron's functioning properly, we know that the thyroid's functioning properly. We know then that the body's going to be able to lose weight better because the thyroid's functioning better. You're going to have more energy. When you have more energy, you're going to feel better. You're going to be less depressed. All these pieces came to play, and that's what we saw in the back end of the physiology is what's helped you so much.
Yep.
All right, now let's go back to the screen. I hope I don't just make it all disappear. There we are.
Yay, we're here.
That's good. Okay, so so when we originally sat down with you, I'd really like an honest conversation here with you about this. When we went over your care plan, we went over the financial obligations, we mapped it out for you. What was going through your head? I mean,
well,
what did you guys talk about when you saw that?
I knew before we had the first appointment how potentially expensive it could be, because I'd done a lot of research online, and I knew it was expensive. And it is really frustrating to me that traditional medical insurance doesn't cover this stuff yet. I'm hoping they figure it out. But so talking it over with my husband, it was a big decision because it is expensive. But I felt really strongly that this is the way that I wanted to go, and he supported me in that. And so we decided to do it.
Yeah. So do you guys pay for your own health insurance?
You mean on our own, or well, my husband has through his work, and we pay out of the paycheck. Is that what you mean, or? Yeah,
I was just wondering if he has to pay for his insurance, if it's a portion that he pays, or if you guys pay all of it. So, for example, I'll give you an example. Right now in the United States, the average American pays $445 per month for their health insurance. And what's interesting about that, the average family then, like in my family, it's $1,100 a month that we pay for our health insurance. Yeah. What's interesting is we pay that money for the peace of mind that if something does happen, we have something to pay for those coverages. So it's just a peace of mind. Like we get no benefit other than peace of mind.
Right.
So that's over $12,000 a year that my family pays for the peace of mind and saying, hey, we have insurance if something bad happens, we get no benefit from it.
Right, right.
With your care, it obviously wasn't $1,100 a month for the entire year. So expensive is one term, but what's really happening, I think, Holly, is that medical care is getting really, really outrageous. Just the insurance cover us.
You're right. I had one prescription, and it was for a menopause symptom, a feminine menopause symptom. And with the insurance that we had, quite honestly, it was hundreds of dollars. It was over $100. It was like $150 a month for this prescription. No, it was more than that. It was several $100s per month for this prescription. Wow. And the solution that Dr. Mack offered was, I might be wrong on this, but it's about $15 and it lasts months.
Yeah.
So, I said to right there, I go, look, we're saving money.
Well, and that's the thing, I guess, is people need, I hope that you understand, I hope a lot of people understand that our care is just that, it's care. And, when you went through our office, you didn't come in, you didn't come in for one visit. We said, hey, see you in 5 months. You came in, you saw us every couple of weeks, every month initially.
Right. Yep. Every 2 weeks and once every month. Yep.
Yeah. Do you think that was necessary?
Yes, I do. because every time I would go in, she would tweak things. We would discuss, what symptoms I was having, how they changed, and she would tweak, supplements that I was taking. So yeah, I think it was important.
And there was a lot of hand holding and ups and downs and hugs.
Yep.
And I mean, it's not easy to get healthy. And
Right.
that's why I look at it too, is we're there to be help you, hold you accountable and help you in this process so that we can ensure your success. And that's really what it's about. Because trust me, I'd love it if I could just give people magical pile us up and say, here, see you in 5 months. And
I know.
But I've done that, and I've seen that in other clinics, and it just doesn't work because, I mean, you're going to lose your way. You're going to lose your way. You're going to lose your focus, and it's just not going to work.
Right. And every person's different, and have different things happen in a month or whatever. So yeah, that makes sense.
Yeah. And if you look at your care too, I mean, we didn't just do it's funny because you came in for hormones, but we never really gave you anything specific for your hormones. I mean, here we are, we're helping your gut. We're getting your gut healthy. We're helping your body detoxify. We're helping you get the nutrients that your body actually needs so that your body can balance its own hormones. Instead of trying to manipulate those hormones or even try to manipulate your brain chemistry by giving you Prozac, we're trying to help your body. We're trying to rebuild and help rebuild your body of 45 years, 50 years of some imbalances that have been going on probably for a long time. So I think the menopause was probably the final straw, but there was definitely something going on there beforehand. I don't think that's what your physiology was showing us when we looked at your testing. I don't think that H. pylori just popped up that year. I think it's something that probably could have been there for years.
Right. Okay.
So let me ask you, has it been a good investment for you?
Absolutely. 100% worth it.
Yeah.
No regrets at all.
That's good.
I feel so much better.
And it's nice to know the solution to your problem instead of having to just use Band-Aids for the rest of your life, which could have ultimately led to you, like we talked about, those other markers. I mean, I hate to say it, but that one marker being high, that beta-glucuronidase or the calcoprotein in your gut, that puts you at high risk for colon cancer. So we don't know what we're helping you prevent to avoid, but those things can be, I mean, those take you out of work for months and it could ruin your life. So that's the thing. We never really know the impact of what we're doing because it's hard to see that. Sometimes I kind of am a little jealous of the doctors that get to see the patients and actually save their lives at that moment. But I like to think though that in some ways that we've helped change the trajectory of the rest of your life, I hope. And hope continue helping you on this journey.
Yeah.
What would you say to anybody that's out there that's struggling right now with hormonal issues, depression, sleep issues, insomnia? What would you tell somebody that was watching this right now if they were considering this?
I would say definitely go and at least talk to them first before you turn to, just medications and things like that. Go talk to them first. Go talk to integrative wellness centers first, and just do that first appointment and then see what you think.
Well, Holly, I can't thank you enough for taking your time. I certainly hope that today you've been able to inspire some other people to take charge of their own health. And ultimately, I hope that's what we've done for you too. And I just look forward to continue seeing you. And hopefully we'll see you at the Patient Appreciation Dinner in January.
Okay.
All right. So,
thank you.
All right. Take care. Thank you so much.